guys, welcome to this week's episode of Dr. Jaw Breaker. Thank you for tuning in. Hey, if you like this, please forward the link on to somebody that you think may like and want to watch this, or that you just want to gross out. Make sure you subscribe, hit the subscribe button down below, and leave a comment as well. Happy to answer any questions that you may have. We have a kind of an interesting case this week of somebody that had a dental implant placed in their upper left front tooth. Now, this implant that was placed fairly deep, and the bone kind of had been lost in that area, and the soft tissue had kind of shrunk back as well. So now that tooth looked a lot longer than what the one next door did. So I'm going to show you a radiograph here just so you can kind of get a feel of what that looked like and what the plan is. Well, let me start with what the options are. Okay, so if you look right here, you can see how this bone in this area moves down, and it sits at the appropriate level, but because of the vertical position of this implant, we'd rather see things up here. By moving the bone up this direction and the implant up this direction, we can also move the soft tissue. Now, your options in this area would be to take the implant out, start over, fill this up with bone, hope it heals in a reasonable way, and you're trying to increase the vertical height, which is a tough move. What we decided to do, which is more predictable, is to make a cut in the bone in this area around the dental implant, moving the bone and the implant up. More, we call that coronal, which basically what we did first is we took this tooth and made it so that it was the same length as what the tooth next door was, so that, and then made a plastic guide or stent that sat on the other teeth, so that when we pulled this down, we just wired that into the splint, keeping it moved down in a vertical direction. Now, this created a gap up in this area, and this gap was filled in with a material called AUGMA, a bone grafting material. This needs to be held in place for about 8 weeks, and then everything will be removed, and then a new restoration can be placed on this implant, giving us a much more aesthetic and normal crown height, where it matches the left and the right crown. The central incisors basically will have the same position of the free gingival margins, making them more aesthetic. All right, let's go and check out this surgical procedure.
I've never seen it. I've never seen this done.
I didn't even know we could do it. Like what?
Ooh, yeah, I can see the hole. Yeah.
Okay, this is the one where it's a little tighter between that root and this. Still a fair amount of space, but it's just a little bit tighter.
How the hell did you see it?
Sorry, sir. Oh, you're good.
Yeah, you can't see it. You just gotta kind of go with where you know it's supposed to be or where it is. Tap, tap. Tap, tap. Tap, tap. Move a little harder. This is pretty thick going here, so I'm going to grab all of this.
He's hard-headed.
He's a little hard-headed. Stuff in there. Okay, I need someone to hold this thing to Minnesota so I can get in there. Okay, you want a suction on there so it doesn't get dusted on her.
I think you might need some pain pills.
Some what?
Prescriptions.
It's gonna hurt, isn't it?
He was saying he didn't want any pain medicine.
Oh, no, I don't want that. Oh, yeah.
You should have a little.
Give me a bunch so I can sell them, will you?
Yeah. They feel really good at the high schools.
I'm gonna do the Walmart parking lot.
Dollar store's always good back too. True, yeah.
Puppies and oxycodone sell really well at Walmart.
So you just make a little groove and then you cover it with that, huh?
Use this to complete it. tricky part is that this part's pretty much blind. That bone's really thick back
Yeah,
there.
right? I wouldn't want to remember this.
You're doing okay though?
Oh, it doesn't bother me.
Okay. I didn't think so, but sometimes if it's on somebody you know, you never know.
I don't like him that much.
Gotta check in on the food.
Hope he doesn't remember that.
The one party will.
Yeah, all right. Want me to hold that?
Nope. It's stuck.
You can do it.
Come on. We're getting there.
You like doing this?
He looks so red.
I know he does look really red.
Yeah. It's fun. It takes a little time. A little more time, and it's a... Alright guys, this is the post-operative video showing the coronal movement of the interproximal bone to a normal position with that implant in number 9 after doing a localized osteotomy. Now, in pulling it more coronal. Now, granted, this is you know, a little off. This X-ray it's very accurate, but it's just a scan that doesn't really give you a full appreciation because of its current angle. But you can see how that interproximal bone, especially, let's see if I can get this pointer to get there, you know, right here, is up much higher than where it used to be. All right. Thanks, guys. All right. Well, I'd like to thank all you guys for tuning in to our videos on Dr. Jaw Breaker. We've reached 1,000 subscribers, which is super cool. Thank you so much for that. And I'm super excited about the next 1,000 and the next 1,000 after that. You're going to notice a little step up in video and audio quality. We've got some things in mind here, so keep an eye out for that, and look forward to seeing you on the next episode.
% overall drop in opioid use. And with the proper understanding and use of Exparel, you too can see the success that Exparel will bring to your clinic. Dr. McClelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.